Hi guys. Today I like to discuss about surgical instruments, and for a good surgeon, you should know your instruments also. Like this one is BP handle, Bird Parker handle. This instrument is used to carry or to use surgical blades. Here, this part we fix the blades, and you can see this is number 4 BP handle, Bird Parker handle, used to carry 20, 21, 23 number blades.
Rampsless sponge holding forceps. It is a long instrument, 9.5 inches with a thin shaft. It is a catch lock which helps in holding the sponge or swab firmly while cleaning. The blades are fenestrated near its distal end and the inner aspect of blades is serrated. Most common use is for cleaning the operative field. It is also used for swabbing a cavity. It can be similarly used for packing cavity. It can also be used for mopping ooze from the operating area so that the structure can be identified easily in cystic duct identification. It can be used to hold solid soft hollow organ during operations, example, holding gallbladder for the Hartmann's pouch during cholecystectomy. It can be used to blunt dissection at the depth for dissecting the perinephric fat. It can be
Our next important instrument is needle holding forceps. These are long instruments with comparative small blades, joint, and there is a catch lock, two fenestrated ends for holding. Again, you have to hold like scissors distal to your DIP and support it with your index finger. Now you can see inside blade there is crisscross fenestrations, if you can appreciate, and there is a vertical groove for firm holding the needle. So this is straight needle holder. There are curved needle holder also. This is small needle holder for fine surgeries. Here also crisscross serrations and vertical groove, catch lock, hinge joint. This is catch lock to prevent slippage of needle.
This instrument is needle holder. The blades are much smaller as compared to handle. The blades have crisscross serrations or is poked on its surface.
These are hemostatic or artery forceps. This is curved mosquito forceps. Here there are small blade, hinge joint, catch, lock, fenestrated ends. And in this, major difference from the needle holder is serrations are in transverse direction. And we can see straight mosquito forceps also. You can see there is no curve. Lock is there, joint is there, blade, shaft.
Now coming to the artery forceps. These can be small or mosquito, medium, large or pedicular. There can be tooth type and non-tooth type. Tooth type are Cocker's artery forceps, Lance artery forceps, and non-tooth type are Kryle's artery forceps, Spencerville artery forceps, and Holstead artery forceps. It is a light but strong instrument. The inner margin of the blade are serrated and the closer the blade are well opposed, leaving no gap in between. The blades are conical and blunt. The blades can be held together by means of a catch lock. Uses of artery forceps as a hemostat, as a pedicular clamp for spleen and kidney, to crush the base of the appendix during appendectomy, to hold the cut edges of the fascia aponeurosis peritoneum after incising them, during dissection on or for closure after surgery, to open up the abscess cavity, breaking all the loculi and causing free bleeding. Hilton's method, to hold needles for suturing as a substitute for a needle holder, to hold free ends of the tension suture as they are passed one after the other without tying, till the requisite number of sutures are given. Similarly, to hold the free ends of the suture left long during the intestinal anastomosis, till they are finally tied off. To hold the tape of the abdominal packs to the drapes, thereby ending any chance of leaving the abdominal pack inside undetected. This one is interesting. Journey's retractor. It is a retractor with a small blade on one end and bly flanked hook on the other end. The hook and the blade are directed in opposite opposite direction. Instrument is made light by fenestrating its shaft. This detector is used for superficial detection. The solid blade is used for detecting the margin of the incision. Example during laparotomy. The biflanged hook end is used to detect the end of the incision. Example during the closure of the laparotomy wound. The biflanged end can be used for giving the last deep stitch during the wound closure.
This is again BP handle, Bird Parker's handle, number 3, used for finer surgeries to carry 15 number, 11 number blade. 11 number blade is used for abscess drainage. This you can see suture cutting forceps, blade with joint, shaft and fenestrated end. Now coming to the forceps. This one is tooth forceps, always hold like a pen. This is to hold tough structures, fascia, tendons. And this is non-tooth forceps, less traumatic, used for finer dissections and to hold bowel and finer structures like nerve and vessels. Also very interesting. This is medicine bow scissor, tissue cutting scissors. As you can see, these are the sharp blades for finer dissections, and this is hinge joint, and there is no catch lock, and there are two fenestrated ends are there to hold the instrument. And how to hold these kind of instrument? Always try to keep these instruments distal to your distal DIP joints so that they will not slip from your grips. These instruments used for finer dissections.